Hello. Welcome to our Total Care Clinic. How may I help you? My name is Mary.
I am John. Mary is a counselor and I am a psychologist.
Hi. Nice to meet you. My name is Annie. I am the Community Outreach and Network Coordinator for our clinic. I am responsible for community relations and I support our referral process.
We are here because mental health professionals in our community have heard that you want to find a way to provide coordinated and accountable care using mental health professionals. We would like to know more and see if we should be more involved in this process.
Great. You might want to become more involved. This is going to change how we make referrals. It will also change who we refer our patients to. And it will increase the number of referrals that we make to mental health professionals. Why are you changing the way you make referrals? We are going to do things differently now because of changes in state and federal law. We are making changes because we are responsible for the referrals we make. But honestly, we don't know how to make referrals in a coordinated and accountable way to mental health professionals. We have a large number of patients and we can't figure out how to refer effectively, consistently and appropriately.
Why is it so difficult?
Our doctors know what other doctors do. We don't know many mental health professionals and there are too many to keep track of. You are all very different and it is hard to tell what you can and can't do. And frankly, a lot of our patients find it difficult to find a mental health professional. They get an appointment, but it can be with the wrong professional. Our patients come back and tell us that counselors and therapists don't always call them back. Or they say the professional's practice is closed, or they don't bill insurance. Some mental health professionals have waiting lists that are 3 to 5 weeks long. Yes, that is a problem. I am wondering, what are federal and state laws requiring you to do differently? First of all, we are expected to coordinate care between our physicians and mental health professionals. Medicare and public health care reform is requiring us to coordinate care and to be accountable. And since over 60% of healthcare dollars are Medicare, that establishes a strong standard of care. Commercial insurance usually follows that standard. We believe that coordinating care and accountable care is a standard that will soon be required in the public and commercial insurance industry. We also believe that public agencies that purchase commercial insurance for their employees are going to require coordinated and accountable care. There's a second reason. Our physicians and clinics are now required to be accountable for the care we provide and the referrals we make. In medical care, our physicians make a referral for a patient to see a specialist, and then we provide copies or access to the patient's electronic health records. Our physicians talk to each other. That doesn't happen in mental health. It is really hard to make a referral to mental health professionals because mental health professionals often don't have office staff. They don't answer their phones. The third reason is this. We need to demonstrate that we are actually helping our patients and not just making money. It costs more money when care is fragmented and not coordinated. This is all part of the triple aim.
What is the triple aim?
The triple aim is this. First, improve the health of the population. Second, we want to enhance the patient's experience of care. This includes quality, access and reliability. And finally, we need to manage or at least contain the cost of care. All right. Thank you. I think I understand what the triple aim is. I would like to ask a question about something you may have said before. What does it mean when you say that physicians are responsible for the referrals you make? That is a good question, but complex. Let me see if I can answer that simply. First, it has come to our attention that many mental health professionals are not licensed. Many do not follow important standards of care and are not compliant with HIPAA and other security requirements. We need to know, and insurance companies want to know, that we are referring to qualified professionals who are following state and federal laws. Second, we are expected to connect our patients with appropriate and qualified counselors, social workers, therapists, and psychologists. We can no longer just tell our patients to go find a counselor in the yellow pages. We can't say that we heard that someone is good. You might call her. We need to make referrals effectively so that patients get the care they need. We need reliable and accountable referrals. Okay, can you help me understand a little more what you mean by reliable and accountable referrals? When we make a referral, we need a number of things to happen. We need to know that a professional is compliant with HIPAA and they are in line with important standards of care. We need to know if they are accepting new patients. We need to know the patient was seen, evaluated, and we need to know that a treatment plan was created. We also need to know the diagnosis, prognosis, and what progress is being made. Progress measures need to be consistent and allow us to focus on population health and well-being. But more importantly, we need to know about any medical concerns that need to be coordinated with our physicians. Our physicians are very concerned about the effects that medications have on the mental and emotional well-being of our patients. I have a question. I worry about focusing too much on measuring progress. The reason I ask this is because prevention is not always measurable except over a long period of time. And trauma as a child doesn't show up until later in life. These things may not be measurable for a decade. I think this is probably why healthcare reform is important. And I think a lot of physicians realize what you are saying. Everyone, physicians and mental health professionals, are having to change.
Thank you for saying that.
May I ask another question? Sure. What about patient confidentiality? Some patients don't want their mental health information in their medical record. Of course, confidentiality is important. But if a physician makes a referral to a mental health professional, then we want to coordinate care in a way that is accountable. For example, it is very important to coordinate care when a patient is started on a medication for a mood disorder, or a patient is given a medication for sleep or a panic attack. We need to know that the patient is getting treatment. We don't need private information. We just want to make sure patients don't end up in an emergency department because of panic attacks, untreated depression, the effects of stress or medication side effect. Is this right? You don't need personal information. No. We don't. How can mental health professionals coordinate and provide accountable care? Coordinating care is important. But we also need reliable ways to measure what we are doing. We believe that physicians and mental health professionals need to provide each other with information that is meaningful and useful. Our physicians need ways to evaluate the progress that patients are making in a standardized manner. How do you do that? I mean, normally I just check a box on a health insurance form that says I am coordinating care. Or, I fax the physician my chart notes. No. I am afraid that will not work. We need consistent and reliable procedures that will allow us to measure what we are doing. For example, we need to know if a patient with an eating disorder is actually going to their appointments. Our physicians know that untreated mental and behavioral problems drive up the cost of healthcare and generate unnecessary physician and hospital office visits. We want to encourage the patient to seek out the care they need, and we want them to find a professional they want to work with. We don't want patients to simply give up.
So how can we coordinate care in a reliable and consistent way? You have identified a problem that mental health professionals have been struggling to solve.
It is difficult. There is currently no reliable system operating in our state that is capable of coordinating care between independent physician groups and independent mental health professionals. Hospitals and large clinics that have their own in-house behavioral health department have a real advantage. They have interoperable electronic health records that can coordinate care. They can make referrals internally. They are accountable because they are associated with each other and they work together. I thought healthcare reform requirements apply only to Medicare and public health dollars. I did not think it applies to private insurance and private patients. Well, actually, it applies to public insurance and also applies to commercial insurance. The reason is this. Commercial insurance is beginning to require that we coordinate care between specialists. Mental health professionals are considered specialists. They are in fact expected to work with physicians and other specialists. Physician practices are going to be measured on their effectiveness providing overall medical care. In order for us to accomplish this, our clinic became certified as a PCMH. What is a PCMH? A PCMH stands for Patient-Centered Medical Home. In a patient-centered medical home, patients have a relationship with a personal physician. A practice-based care team takes collective responsibility for the patient's ongoing care. The care team is responsible for providing and arranging all the patient's healthcare needs. Patients can expect care that is coordinated across care settings and disciplines. Quality is measured and improved as part of daily workflow. The patient's experiences enhance access and communication. And the practice uses electronic health records, registries, and other clinical support systems. So let me see if I understand this. Healthcare reform is going to change how physicians make referrals, and it will change who will get referrals. And if mental health professionals can do so in a coordinated and accountable manner, that could actually increase the number of referrals made to mental health professionals. And physicians will be less willing to work with mental health professionals who cannot support their medical practice. Clinics want to maintain the certifications and qualify for incentives. Yes, I think that is correct. But there is also this. We cannot continue to refer to a community of mental health professionals if they are not willing to coordinate care and be accountable. So all this is going to change how mental health professionals document, measure patient progress, transmit information, and how we interact with physicians as well as public and commercial insurance companies. Yes, we think so. It is already changing how physicians document and measure the services we provide. We just can't make money on the number of office visits we can generate. We actually have to prevent health problems so that patients don't keep coming back. We need to show that we can improve the health of our community.
This has been very helpful. We need to study this issue more. Unfortunately, many mental health professionals are focused on what they are doing currently and not what will be expected in the future. Many won't change until they feel the pressure change and they see everyone else changing. But even then, many will prefer to practice the way they always have. Especially if they are going to retire in the next 5 to 7 years.
I agree. It may be that the most experienced and qualified mental health professionals will see what needs to change and express objections. I think new and mid-career professionals will see the challenges in terms of opportunities to change, modernize, and grow their practices.
Yes. I think that early and mid-career professionals will be the most progressive, especially those who are qualified and have experience working with physicians. This has been really helpful. Thank you for your time. We should probably go now and let you get back to work.
You are welcome. By the way, members of the mental health community are offering informational meetings and trainings for mental health professionals in coordinated and accountable care. Maybe you would like to attend. I understand that there is already have a list of interested professionals. It sounds like the train is already boarding. We would like to attend.